Welcoming a new baby is a life-changing experience, and while much attention is given to the newborn, it's equally important for parents to focus on their own health after childbirth. Postpartum health checkups are essential for both mothers and fathers, as they help identify and address any physical or emotional challenges that may arise. In this video, we'll walk you through a realistic and comprehensive checkup plan for postpartum parents, highlighting key screenings and why they matter. Let's start by understanding the importance of regular health assessments during this critical period. After childbirth, parents undergo significant physical and emotional changes. Postpartum checkups are designed to monitor recovery, detect complications early, and provide support for mental health. These visits are not just about healing from delivery, they're about ensuring long-term well-being for the entire family. By following a structured checkup plan, parents can address issues like fatigue, hormonal shifts, and emotional stress, setting the stage for a healthier future. Let's explore what a typical postpartum checkup schedule looks like and how it benefits both mothers and fathers. The first week after delivery is crucial for both parents, especially mothers. During this period, healthcare providers typically conduct an initial assessment, either in the hospital or at home. This checkup focuses on vital signs, wound healing, and any immediate complications such as excessive bleeding or infection. For mothers who had a cesarean section, incision care is closely monitored. Fathers or partners are also encouraged to discuss their well-being, as the transition to parenthood can be overwhelming for everyone involved. Physical recovery after childbirth varies for every mother. The postpartum checkup plan includes monitoring uterine involution, vaginal bleeding, and perineal healing. Healthcare providers also assess for signs of infection, blood clots, or other complications. If the mother had a cesarean section, special attention is given to the surgical site. These assessments help ensure that the body is healing properly and that any issues are addressed promptly, reducing the risk of long-term health problems. Mental health is a vital part of postpartum care. Both mothers and fathers can experience mood changes, anxiety, or depression after the birth of a child. Postpartum depression is common and can affect anyone. During checkups, healthcare providers use screening tools to assess mental well-being, asking about mood, sleep, and stress levels. Early detection allows for timely support and intervention, helping parents navigate the emotional challenges of new parenthood. Monitoring blood pressure is especially important for mothers, as conditions like postpartum preeclampsia can develop after delivery. Regular blood pressure checks help detect any abnormalities early. For both parents, maintaining heart health is crucial, as the stress and lack of sleep associated with caring for a newborn can impact cardiovascular well-being. Healthcare providers may recommend lifestyle adjustments or further testing if any concerns arise during these screenings. Blood tests are a routine part of postpartum checkups. For mothers, these tests can check for anemia, thyroid function, and blood sugar levels, especially if gestational diabetes was present during pregnancy. Fathers may also benefit from basic screenings, particularly if they have a history of health issues. Lab work helps identify underlying conditions that could affect recovery or overall health, allowing for early intervention and management. A strong pelvic floor is essential for postpartum recovery. During checkups, healthcare providers assess pelvic floor strength and function, especially if the mother experienced a vaginal delivery. Issues like incontinence or pelvic pain are discussed, and referrals to physical therapy may be made if needed. Fathers can also benefit from discussions about core strength and overall physical health, as caring for a newborn often involves lifting and physical strain. Breastfeeding can be challenging, and postpartum checkups provide an opportunity to address any concerns. Healthcare providers assess latch, milk supply, and nipple health, offering guidance and support. If breastfeeding is not possible or chosen, discussions about formula feeding and infant nutrition are also included. Fathers are encouraged to participate in these conversations as their support is vital for successful feeding and bonding. Postpartum checkups are an ideal time to discuss contraception and future family planning. Healthcare providers review options that are safe for breastfeeding mothers and address any concerns about fertility. Fathers are included in these discussions to ensure that both partners are informed and comfortable with their choices. This proactive approach helps prevent unintended pregnancies and supports the family's overall well-being. Sleep deprivation is a common challenge for new parents. During postpartum checkups, healthcare providers discuss strategies for managing fatigue, improving sleep quality, and sharing nighttime responsibilities. Both mothers and fathers are encouraged to prioritize rest and seek help when needed. Addressing sleep issues early can prevent burnout and support better mental and physical health for the entire family. Proper nutrition is key to postpartum recovery. Healthcare providers review dietary habits, recommend nutrient-rich foods, and discuss safe weight loss strategies if desired. Both parents benefit from these conversations as healthy eating supports energy levels and overall well-being. Special attention is given to mothers who are breastfeeding, ensuring they receive adequate calories and hydration for milk production. Thyroid disorders can develop or worsen after childbirth, particularly in mothers. Postpartum checkups often include thyroid function tests to detect conditions like hypothyroidism or hyperthyroidism. Symptoms such as fatigue, mood changes, or weight fluctuations may prompt further investigation. Early diagnosis and treatment are essential for maintaining energy and emotional balance during the demanding postpartum period. For mothers who had gestational diabetes, postpartum checkups include blood sugar testing to ensure levels have returned to normal. Even if gestational diabetes was not present, screening for diabetes is important, as the risk can increase after pregnancy. Fathers with a family history of diabetes may also benefit from periodic checks. Early detection supports better long-term health for both parents. Anemia is common after childbirth, especially if there was significant blood loss during delivery. Postpartum checkups include blood tests to check hemoglobin and iron levels. Symptoms like fatigue, weakness, or dizziness are discussed, and iron supplements may be recommended if needed. Fathers are also encouraged to monitor their own energy levels and discuss any concerns with their healthcare provider. Pregnancy and breastfeeding can impact bone density, making calcium and vitamin D important nutrients for postpartum mothers. Healthcare providers may recommend bone health screenings or supplements, especially for those at higher risk of osteoporosis. Fathers are also encouraged to maintain a diet rich in calcium and vitamin D to support their own health and set a positive example for the family. Postpartum checkups are a good time to review immunization status. Mothers may need vaccines such as Tdap or influenza, and fathers should also be up to date to protect the newborn from preventable diseases. Healthcare providers discuss recommended vaccines and create a plan for any necessary updates, ensuring the whole family is protected. Sexual health is an important aspect of postpartum recovery. During checkups, parents can discuss any concerns about intimacy, libido, or physical discomfort. Healthcare providers offer guidance on when it's safe to resume sexual activity and address any emotional or physical barriers. Open communication helps strengthen relationships and supports overall well-being for both partners. Changes in urinary and bowel function are common after childbirth. Postpartum checkups include questions about incontinence, constipation, or other digestive issues. Addressing these concerns early helps prevent chronic problems and improves quality of life. Fathers are also encouraged to discuss any changes in their own health, as stress and lifestyle shifts can impact digestive well-being. Pain is a common part of postpartum recovery, whether from delivery, surgery, or breastfeeding. Healthcare providers assess pain levels and offer strategies for relief, including medication, physical therapy, or lifestyle adjustments. Fathers are also encouraged to discuss any physical discomfort, as caring for a newborn can lead to back pain or muscle strain. Effective pain management supports faster healing and a smoother transition to parenthood. The emotional journey of parenthood can be overwhelming. Postpartum checkups provide a safe space for parents to share their feelings and seek counseling if needed. Healthcare providers offer resources for support groups, therapy, or crisis intervention. Fathers are encouraged to express their emotions and access support, as their mental health is just as important as the mother's during this transition. Strong communication between partners is vital during the postpartum period. Checkups often include discussions about relationship dynamics, stress management, and conflict resolution. Healthcare providers may offer tips for maintaining a healthy partnership and balancing parenting responsibilities. Open dialogue helps prevent misunderstandings and strengthens the family unit. Gradually returning to physical activity is important for postpartum recovery. Healthcare providers assess readiness for exercise and recommend safe activities based on individual health status. Both mothers and fathers benefit from incorporating movement into their routines, as it supports energy, mood, and overall health. Personalized exercise plans help prevent injury and promote long-term wellness. Parents with pre-existing health conditions, such as hypertension, diabetes, or autoimmune disorders, require ongoing monitoring during the postpartum period. Checkups include medication reviews, symptom tracking, and coordination with specialists if needed. Fathers are also encouraged to stay on top of their own health, as managing chronic conditions supports the entire family's well-being. Blood clots, or deep vein thrombosis, are a rare but serious risk after childbirth. Postpartum checkups include screening for symptoms such as leg pain, swelling, or redness. Early detection is crucial for preventing complications. Both mothers and fathers should be aware of the signs and seek medical attention if any concerns arise. Vision and hearing can sometimes change after pregnancy due to hormonal shifts or blood pressure changes. Postpartum checkups may include basic screenings to ensure there are no lasting effects. Fathers are also encouraged to monitor their own sensory health, as early detection of changes can prevent long-term issues. Oral health can be affected by pregnancy and the postpartum period. Checkups include reminders to schedule dental visits and maintain good oral hygiene. Both mothers and fathers benefit from regular dental care, as healthy teeth and gums contribute to overall well-being and set a positive example for children. Hormonal changes after childbirth can affect skin and hair. Postpartum checkups include discussions about common issues like hair loss, acne, or stretch marks. Healthcare providers offer advice on skincare routines and when to seek further treatment. Fathers may also notice changes due to stress or lack of sleep and are encouraged to discuss any concerns. Pregnancy can alter the immune system, sometimes triggering new allergies or autoimmune symptoms. Postpartum checkups include a review of any new or worsening symptoms. Healthcare providers may recommend allergy testing or refer to specialists if needed. Fathers are also encouraged to monitor their immune health, especially if they notice changes after the baby's arrival. Postpartum checkups are a good time to review all medications and supplements. Healthcare providers ensure that prescriptions are safe for breastfeeding and adjust dosages as needed. Both mothers and fathers should bring a list of all products they are taking to each appointment. This helps prevent interactions and ensures optimal health for the entire family. Lifestyle choices like smoking, alcohol, or substance use can impact postpartum recovery and family health. Checkups include honest conversations about these habits and offer resources for quitting or reducing use. Both parents are encouraged to make healthy choices, as their behaviors influence the well-being of the newborn and set lifelong examples. The postpartum period can be stressful, and unfortunately, some families may experience increased tension or violence. Healthcare providers screen for signs of domestic violence during checkups and offer resources for safety and support. Both mothers and fathers are encouraged to speak openly about their home environment, ensuring everyone's safety and well-being. Financial stress and lack of social support can affect postpartum recovery. Checkups include discussions about access to resources, community programs, and support networks. Healthcare providers may refer families to social workers or financial counselors if needed. Both parents are encouraged to seek help and build a strong support system for their growing family. Postpartum checkups are not just for parents, they're also an opportunity to discuss infant care. Healthcare providers answer questions about feeding, sleep, development, and safety. Both mothers and fathers are encouraged to participate, ensuring they feel confident and supported in their parenting journey. During postpartum visits, parents receive information about the recommended vaccination schedule for their baby. Healthcare providers explain the timing and importance of each vaccine, addressing any concerns or questions. Both parents are encouraged to stay informed and keep accurate records to ensure their child's health and protection. Healthcare providers use postpartum checkups to discuss developmental milestones for the baby, such as motor skills, social interaction, and language development. Both parents are encouraged to observe and support their child's growth and to raise any concerns early. Early intervention can make a significant difference in a child's long-term development. Postpartum checkups include breast exams for mothers to screen for lumps, infections, or other concerns. Fathers are also encouraged to perform regular testicular self-exams and discuss any changes with their healthcare provider. Early detection of issues in either parent supports long-term health and peace of mind. Understanding family medical history helps healthcare providers tailor postpartum care. Checkups include a review of genetic risks, hereditary conditions, and any new diagnoses in the family. Both parents are encouraged to share updates, as this information can guide future screenings and preventive care for themselves and their child. A realistic postpartum checkup plan includes scheduling future appointments for ongoing care. Healthcare providers help parents set reminders for follow-up visits, screenings, and vaccinations. Both mothers and fathers are encouraged to stay proactive, as regular checkups support long-term health for the entire family. Telehealth has become an important option for postpartum care, offering convenience and flexibility. Virtual checkups allow parents to discuss concerns, review symptoms, and receive guidance without leaving home. Both mothers and fathers can benefit from remote consultations, especially when in-person visits are challenging. Telehealth ensures continuity of care and quick access to professional advice. Postpartum checkups include education about emergency warning signs that require immediate medical attention. Parents are taught to recognize symptoms such as severe pain, heavy bleeding, high fever, or difficulty breathing. Both mothers and fathers should know when to seek help, as prompt action can prevent serious complications. Every family is unique, and postpartum checkup plans should be personalized. Healthcare providers work with parents to address specific needs, preferences, and health risks. Both mothers and fathers are encouraged to ask questions and advocate for their well-being. A tailored approach ensures that all aspects of health are covered and that parents feel supported throughout their journey. Access to resources and support networks is crucial for postpartum parents. Checkups include information about local groups, online communities, and professional services. Both mothers and fathers are encouraged to connect with others who understand their experiences, fostering a sense of belonging and reducing isolation. Let's recap the essential screenings and checkups for postpartum parents: physical recovery, mental health, blood pressure, lab work, pelvic floor, breastfeeding, contraception, sleep, nutrition, thyroid, diabetes, anemia, bone health, immunizations, sexual health, pain management, chronic conditions, and more. Regular checkups and open communication with healthcare providers ensure a healthy start for the whole family. Taking care of your health after childbirth is one of the best gifts you can give your family. By following a realistic checkup plan and staying proactive, both mothers and fathers can enjoy a smoother recovery and a stronger start to parenthood. Remember, you're not alone. Reach out to your healthcare team and support networks whenever you need guidance or reassurance. Wishing you and your family health and happiness on this incredible journey.